Hello, my name is Steve Arnold and I'm a family physician.
We are made of billions of cells. Cells are the basic building blocks of our bodies. There are two major types of germs that invade our bodies and make us sick. There are bacteria that are larger and can be treated with antibiotics, and there are viruses. Viruses are not strictly alive. They are more like little pirate robots that when they attach to the surface of our cells automatically inject a little message into our cells that then transforms them into virus factories. After a week or two of producing viruses, our cells eventually die and rupture, releasing thousands of viral particles. You might wonder how our body defends against viruses. Well, we now understand that a key step in infection involves the attachment of a virus to surface receptors on our cells. And our body produces antibodies that will eventually coat the surfaces of infecting viruses and block their ability to attach to our cells. There are also specialized cells that eat viruses once they have been coated by antibodies. Why then do we need vaccinations? Well, the problem is that the first time our body sees a new virus, it's slow to produce antibodies, and in the week or two that it takes, the virus spreads through our body and multiplies into the millions, making us sick. On the other hand, when our body is seeing a virus for the second time or has been primed by a vaccination, the immune system responds rapidly, produces large amounts of antibodies quickly, and in this way the viruses are not given the chance to spread and multiply. So what are vaccinations and how are they produced? There are a few types of vaccinations. The first is one that uses live cells, live viruses, but that have been passed through a process that makes them very weak so that they are able to produce an immune response but can't make us sick. A way to think of this is to think of a car that where the engine has been taken out and the wheels have been taken off. It still looks like a car, but it can't go very far, and that is basically what we're doing with the virus. The flu vaccination is this type of vaccination. Other vaccinations are produced by taking virus particles and breaking them into pieces and using those pieces to stimulate an immune response, but without making us sick. The Moderna vaccination, which is the vaccination that will be distributed throughout northern Quebec, is another type of vaccination called an mRNA vaccination. A good way to think of these is like molecular Snapchat messages. A message is written in mRNA, and then mRNA is packaged into tiny fat droplets and injected into subjects. Once injected, the fat droplets will be absorbed by our cells, and the cells will read the message. The message tells our cells how to produce spike proteins, and once the message is read, the message is destroyed, and for a brief period of time our cells start producing spike proteins. The spike proteins are then released into our blood, which allows our immune system to be triggered, but after a short period of time the proteins are destroyed and our cells return to normal. You will recall that the spike protein is the protein that allows coronaviruses to infect our cells. But once we have antibodies to these proteins, they will no longer be able to stick to our cells and cause illness. Now, I know that some people will be concerned about side effects related to vaccination. There's a lot of misinformation on the internet and on social media that paints vaccinations as dangerous, where in reality, vaccinations are one of the safest treatments that we have in medicine. If you look at causes of death in Canada, you'll see that the main thing that we should be worried about is things like cancer and heart disease. Suicide and road injuries are common and often related to alcohol use. Even things like bad allergic reactions to peanuts, getting hit by lightning, are more common than severe reactions to vaccinations. So really, we shouldn't worry about getting vaccinated. Another thing I have heard is that some people are concerned by how quickly these vaccinations were developed and whether in order to do so, some corners were cut in terms of ensuring safety. In fact, these vaccinations were produced very quickly, but the steps involved in proving safety were not cut short. The number of people who were enrolled in clinical trials was large, and there's a lot of safety data, as much as any other vaccination. Where government and pharmaceutical companies were able to save time was more with administrative steps. First of all, because the coronavirus resembles SARS and the MERS, some of the work that was done on SARS and MERS on preclinical studies was translatable to the development of the Moderna vaccination. And there was a lot of money put to make sure that there was enough personnel so that the clinical trials were rolled out efficiently. Health Canada reviewed the data as soon as it was available, whereas usually new vaccinations have to wait in line, sometimes years. And finally, companies were encouraged to start producing the vaccinations even before approval, so that as soon as approval was received, already there were millions of doses of vaccination ready to be distributed. So I, for one, am looking forward to receiving the first dose of vaccination myself, and I hope that many people in the community are as well. And I hope that people will consider the fact that not only does the vaccination protect themselves, but it protects vulnerable people that they live with and they are in contact with. If a large enough people in the community become vaccinated, even if we have somebody that comes into the community infected, the virus will have nowhere to go and will die out. On the other hand, if only a limited number of people are vaccinated, the virus will be able to circulate in the community, and we'll be dealing with this virus for a long time to come. This is an important first step to getting our lives back to normal. Thank you.